Your surgery is called a first metatarsophalangeal joint fusion. That long word is often shortened to MTP joint. A fusion is when you take two bones that are connected by a joint and join them together, eliminating motion at that joint. This surgery is a fusion of the two bones at the base of your big toe. The most likely reason for this surgery is for arthritis of that joint at the base of your big toe, or first MTP joint, or for deformity at that joint. As I said, this surgery takes away motion at the joint of the base of your big toe with the goal of eliminating pain that's caused by the motion of that joint. In order to fix the position of those bones in the correct position, we use a plate and screws to hold the bones together. We put this plate and screws in at the time of surgery. Along with the fusion, I will take away any bone spurs that can also cause pain and rubbing at the base of your big toe, especially in your shoes. Having no motion of the joint of the base of your big toe still allows you to walk, and some people can even run after the surgery with no restrictions. The primary restriction from having no motion of the joint of the base of your big toe is that you are limited in the types of shoe wear you can wear. Most people are unable to wear a heel more than about an inch or an inch and a half high. I'd like to go over what happens on the day of surgery to explain everything so that you know what to expect. The main thing on the day of surgery is that you will discuss the plan for anesthesia with one of our anesthesia team members. They will talk to you about whether you would like to have what is called a block. A block is a local anesthetic which freezes your leg or numbs your leg so that you're unable to feel it. This means you cannot move or feel your leg for the first 12 to 36 hours after surgery. It also means that you do not have any pain at the site of surgery for that period of time. You will also have a general anesthetic for the surgery. The main goal of this block is to control your pain for after the surgery. The anesthesia team on the day of surgery will discuss with you the risk and benefits of having a block procedure, and then you may decide whether this is something that interests you. After the surgery is completed, you will have a cast that is a partial cast, which we call a splint. This will stop you from moving your ankle and foot. You will also be provided with a special pillow called an elevation pillow to assist you with elevating your foot, especially important in the first 2 weeks after surgery. I ask for that the first 2 weeks after surgery you elevate your foot above the level of your heart as much as possible. I generally recommend 23 hours a day, only getting up to go to the bathroom or to eat your meals. This is very, very important to limit the swelling in the foot and to give your surgical incisions the best chance at healing successfully. There are no bandages or dressings for you to change after the surgery. The cast will protect your incisions until you come back and see me in clinic. You will have this splint on for approximately 2 weeks after surgery. You cannot get the splint wet, therefore you must protect the splint when you bathe or shower by putting a plastic bag or other protective material over the splint to avoid water getting on it. After surgery, for pain control, we use many different techniques to help make sure you're not in severe pain. The number one technique for limiting pain is actually elevation as well. You can also apply ice packs, and frozen vegetables also work as well, applied to the front of your cast for 30 to 45 minutes at a time, up to 3 times a day. This is most useful in the first 2 weeks after surgery. I will also give you prescriptions in your preoperative appointment for both pain control medications as well as other medications. The number one medication that I would like you to start taking after surgery is Tylenol. You should take 500 milligrams of Tylenol every 4 hours from the day of surgery until 5 days after surgery, regularly. After 5 days, you can take the Tylenol only if you need it for pain. If the Tylenol is not bringing your pain down to about a 4 out of 10 on a scale of 1 to 10, then you may take one of the stronger pain medications that we give you, which is called oxycodone. Oxycodone is to be used only as needed for a pain level of at least 4 out of 10. Always take the Tylenol as the first choice and the oxycodone as the second choice. Most patients only need the oxycodone pain medications for 3 to 4 days after this surgery. If you do have a block for the surgery, it will take approximately 12 to 36 hours for the block to wear off. In order to avoid a severe spike in your pain at the time that your block wears off, I recommend that before bed on the day of surgery, you take 1 Tylenol and 1 oxycodone, and do the same when you wake up in the morning on the first morning after surgery. 1 Tylenol, 500 milligrams, and 1 oxycodone. This is to prevent you having a severe pain spike as your block wears off the next day. I will see you in my clinic at approximately 2 weeks after the surgery. At this clinic visit, we will remove the splint and check your surgical incisions. If everything looks good, we will remove all of your sutures at this time. We will then change your splint over to an air cast boot. This does not mean you can walk on your foot. In fact, you are not permitted to put weight through your foot for 6 weeks after surgery. The boot allows you to remove it to wash for showering, as well as allows you to remove it 3 times a day to move your ankle and toes to prevent stiffness. I would like you to spend 10 minutes every day, 3 times a day, moving your ankle up and down and your toes up and down after this 2-week visit. You may shower after this visit, but you may not soak the foot. Therefore, no bathtubs, no hot tubs, and no pools, at least until 6 weeks after surgery. Also, at your 2-week visit, I will give you a prescription for physical therapy. Physical therapy is meant to start approximately 5 weeks after surgery. This allows you to have time to find a physical therapist and arrange that appointment to start at the appropriate time. I will see you again at 6 weeks after surgery, at which point we will get an X-ray of the foot to ensure healing is progressing appropriately. If the X-ray looks good, I will then let you start to put weight through your whole foot in the air cast boot. Most people use the air cast boot until 8 weeks after surgery and then transition to a regular walking or gym shoe. The reason it takes 8 weeks to go into a regular shoe is that your foot tends to be still too swollen before then to fit into your own shoe. Please do not walk in your bare feet until 3 months minimum after the surgery. I will see you again at 3 months after your surgery when we will get another X-ray to confirm healing. At this point, you should have graduated from the boot over to your regular shoes, as well as be near or completed physical therapy. There are no restrictions to your activity as long as we have not encountered any complications at 3 months after surgery.